Good day, I am John Reoleza from Bis Into Orlando. I will be performing eye installation. Gather equipment, check medication order against the original physician order according to the agency policy, clarify any inconsistency, check the patient's chart for allergies. These comparisons help to identify the errors that may have occurred when orders were transcribed. The physician's order is the legal record of medication orders for each agency. Know the actions, special nursing considerations, safe dose ranges, purposes in administration, and adverse effect of the medication to be administered. Consider the appropriateness of the medication for patient. This knowledge aids the nurse evaluating the therapeutic effect of the medication in relation to the patient's order and can also be used to educate the patients about the medication. Place medication on a tray or move the medication cart outside the patient's room or prepare for administration in the medication area. Organize facilitates error-free administration and save time. Perform hand hygiene to prevent the spread of microorganisms. Transport medication to the patient's bedside carefully and keep the medication in sight at all times. Careful handling and close observation prevent accidental and deliberate disarrangement of medication. Identify the patient by checking the name identification on the patient's identification band or ask the patient to state his or her name. Identify the patient, ensure the right to patient to receive the medication and help to prevent errors. Explain procedure to the patient to gain cooperation and allay anxiety. Offer tissue to the patient. Solution and tears may spill from the eye during the procedure. Cleanse the eyelids and eyelashes of any drainage with a washcloth or cotton balls. Debris can be carried into the eye when the conjunctival sac exposed. Tilt the patient's head back slightly if sitting. Remove cap from medication bottle, being careful not to touch the inner side of the cup. Invert the monodrip that is commonly used and install the eye drops. Have patients look up, focus something on the ceiling. Place thumb or two fingers near margin lower eyelids immediately below the eyelashes. Hold the dropper close to the eye but avoid touching the eyelid or eyelashes. Squeeze container and allow the prescribed number of drops to fall in lower conjunctival sac. Release lower lid after the eye drops are installed. Ask the patient to close eyes gently. This allows the medication to be distributed over the entire eye. Instruct the patient not to rub affected eye. Perform hand hygiene. Hand hygiene prevents the spread of microorganisms. Assess the patient to comfortable position. This ensures patient's comfort.